Hi, glad to see you in this new lesson. We've already talked about how to properly start a consultation and conduct an examination. Now we're moving on to one of the most important stages, explaining and planning treatment. This stage determines whether the patient will accept your recommendations. Your task is not just to make a diagnosis, but to make the patient a co-author of the decision. How can you achieve this? Let's figure it out. To start, let's turn to the research. I like to back up what I say with facts. About 50% of patients misunderstand or forget the doctor's recommendations during the appointment. The reason is quite simple. It's information overload from complex details. After analyzing about 120 audio recordings of doctor consultations, it turned out that doctors spend on average 1 to 2 minutes explaining the diagnosis and planning. And only 34% check whether the patient has understood this information. I think these studies show why it's important to establish a dialogue with the patient and explain everything clearly. But how do you do that? Before moving on to the diagnosis, go back to the original purpose of the visit or the patient's request. As an option, you can use phrases like, "Did you want to address your bite issue?" Or, "Did you want me to tell you everything within my specialty, specifically orthodontics, or about the overall condition of your oral cavity or how to act in different situations?" Often patients appreciate a comprehensive consultation. In addition, this helps the doctor demonstrate their expertise. What is most important to you? Appearance, functionality, or your comfort? What should I focus on and explain to you in more detail? Remember, different patients have different questions. For some, it's important that the oral cavity is simply healthy and that all its elements function properly. For others, beauty, or say, a Hollywood smile comes first. Use visualization. Display photos, screenshots, and 3D scans on the screen. Patients remember 60% more information if it is supported by images. How do you do this? Highlight problem areas with arrows on CBCT scans or photographs. Save screenshots from different angles and upload them to a cloud service. This way, the patient can review them, for example, at home. You can also send the files by email. As I mentioned before, use the services that are common in your country. Talk through each step out loud. This tooth is displaced, which causes the neighboring teeth to experience excessive strain and overload. You can see this arrow right here. Speak in simple, clear language. Avoid medical terms like distal bite or recessions. Instead say, "The upper teeth overlap the lower teeth more than they should. The gum has receded a bit, which can increase tooth sensitivity." Give information in measured amounts. According to research, the average amount of information a patient can absorb at one time is 3, at most 5 key points. And under stress, for example, in the dentist's chair, this number drops to just 2 or 3 points. It's important to break your explanation into sections. First, state the problem, like crowding of the front teeth, then explain the consequences. Because of this, it's harder to clean your teeth there, and this can lead to cavities. And finally, the solution. We can fix this with braces or aligners. Don't forget to pause. Studies show that patients remember only 30 to 40% of the verbal information from a doctor, but breaking it down into these 3 sections, as I mentioned earlier, increases recall to 75%. After each section, check with the patient to see if everything is clear or if anything needs to be repeated. I also recommend using the teach-back method. The idea is to ask the patient to repeat the recommendations in their own words. Just to be clear, this isn't a memory test, but a way to make sure the patient has understood everything correctly. You can say, "Let's check if everything is clear. Tell me how you understood it." Or, "Let's recall together what we discussed." When working with children, you can incorporate a game element, for example. Ask them to show how they will clean their braces. Why is this important at all? According to research, more than 50% of patients forget the recommendations within just 10 minutes after their appointment. When using the teach-back method, adherence to recommendations increases by 62%. Ideally, I would recommend duplicating the recommendations by sending them to the patient's email or providing them in writing, even if you have discussed everything with them and made sure the patient understood. After all, such things can be forgotten soon after the appointment. It is advisable to avoid the following mistakes. First, instead of asking, "Did you understand?" to which people usually just nod automatically, encourage the patient to give a detailed answer. For example, tell me how you will take care of your teeth now. Second, don't ask the patient to repeat the recommendation word for word. This isn't an exam. Our goal is to establish a dialogue and check how the patient has interpreted the information for themselves. Third, don't interrupt the patient and let them finish speaking. Fourth, don't say, "You understood everything wrong," or similar phrases. Gently correct what the patient has said. For example, "To make sure I explained everything clearly, can you tell me how you will now take care of your braces?" Or for instance, the patient says, "I need to clean them after meals with an irrigator and avoid chewing gum." The doctor says, "That's right, but instead of an irrigator, it's better to use a special brush. Let me show you." And then you demonstrate and explain. Fifth, don't use frightening phrases. Instead of saying, "There are big problems here," say, "There's something that needs attention." Or instead of, "Why did you let it get this bad?" say, "Let's figure out how to fix this." It's better to generally praise the patient rather than scold them. For example, you can say, "It's great that you made an appointment. That's already 50% of success. Well done." Now you can move on to planning. How do you offer treatment options? Patients often get confused when choosing, so I use the principle of urgent, necessary, and optimal. I offer them 3 options. An urgent plan, the minimal one. We will relieve pain and inflammation in a single visit. A necessary plan, or a basic plan. We need to plan therapeutic sanitation with you, or in other words, the treatment of your teeth. You have 5 teeth. In one visit, we can treat 1 or 2 teeth. Doing more would be difficult, so we will need 3 visits. The optimal or ideal option is comprehensive treatment. I don't discuss this kind of treatment plan during the consultation. Even if the patient has many issues like cavities, missing teeth, or a misaligned bite. And to sort all of this out, I will need to involve several specialists. In such cases, I prepare either an urgent or a basic treatment plan and present the comprehensive plan separately after diagnostics or a more in-depth analysis. I don't recommend offering the ideal plan at the first meeting, because at this stage the patient doesn't trust you yet, and the cost of treatment can really scare them off. To build a trusting relationship with the patient, I would also advise you first of all to pay attention to your nonverbal communication. Nod, smile, avoid sighing or groaning. Secondly, involve the patient. What do you agree with? And what raises questions for you? Which option do you prefer? Handling objections? If the patient has doubts, don't argue. Say, "Yes, that's an important point. Let's go over it." Offer, for example, a test drive or something similar. So what are the main aspects of effective explanation and planning that we can highlight? Correlation with the request. Did you want to solve this problem? And visualization, this could be a photo, a 3D model of the teeth, marking with arrows, yes, right there on the screen, using language without technical terms, gaps between the teeth. Instead of, for example, the word triumph, right? 3 plan options: urgent, mandatory, optimal. Checking for understanding, or this teach-back method. In the next lesson, we'll go over how to wrap up the consultation. How do you organize everything so that the patient leaves with a clear plan and the desire to get treated by you? Keep sharpening your mind and see you soon.